မှာကျွန်တော် Hello ဆရာဝန် editor ကျော်လေးဖြစ်ပါတယ် Mount Elizabeth Hospital Facebook page ကနေပြီးတော့ကြိုဆိုပါတယ်ကျွန်တော်ဒီ Mount Elizabeth Hospital Facebook page ကနေပြီးတော့ကျန်းမာရေးနဲ့ပတ်သက်တဲ့အသိပညာပေးဆိုင်ရာဗီဒီယိုတွေကိုတင်ဆက်ပေးနေတယ်ဆိုတာအားလုံးသိပြီးသားဖြစ်မှာပါဒီတစ်ခါမှာကျွန်တော်တို့ပြောပြဖို့အတွက်စီစဉ်ထားတာကတော့ကင်ဆာရောဂါနဲ့ပတ်သက်တဲ့အကြောင်းပါအားလုံးသိကြတဲ့အတိုင်းပဲကျွန်တော်တို့ကင်ဆာကပေါ့အရန်ဖြစ်များတယ်ကျွန်တော်နိုင်ငံမှာဆိုလည်းအရန်ဖြစ်များတယ်ကိုဘေးပတ်ဝန်းကျင်တွေမှာပဲကင်ဆာရောဂါနဲ့ပတ်သက်လို့ကျွန်တော်တို့တော်တော်ကြီးတွေ့နေရတယ်ပေါ့နော်အရွယ်ကြီးတဲ့သူတွေရောအရွယ်ငယ်တဲ့သူတွေရောကျွန်တော်ကင်ဆာရောဂါဖြစ်နေတာတွေ့နေရတယ်အဲ့ဟုတ်ပြီဒီကင်ဆာရောဂါနဲ့ပတ်သက်တဲ့အကြောင်းအရာတွေကိုကင်ဆာဆိုတာဘာကြောင့်ဖြစ်ရတာလဲဘယ်လိုကုသမှုတွေရှိလဲကင်ဆာဖြစ်တာနဲ့အသက်သေဆုံးတဲ့အထိဖြစ်ရမှာလားကင်ဆာဆိုတာသေမိတ်လားစတဲ့အကြောင်းအရာတွေကိုကျွန်တော်တို့ဆွေးနွေးဖို့အတွက်ကျွန်တော်တို့ဒီနေ့မှာကင်ဆာရောဂါနဲ့ပတ်သက်တဲ့အထူးကုပညာရှင်တယောက်ကိုကျွန်တော်ဖိတ်ခေါ်ထားပါတယ်ကျွန်တော်ဖိတ်ခေါ်ထားတဲ့သူကတော့ Mount Elizabeth Hospital ဖောက်ကွေးကင်ဆာစင်တာကကင်ဆာရောဂါအထူးကုဆရာဝန်ကြီး Dr. Richard Quat ဖြစ်ပါတယ် Good morning Dr. Richard
Good morning Dr. Turin Thank you very much for having me
အဲ့တော့ကျွန်တော်ပထမဆုံးမေးချင်တဲ့မေးခွန်းဒီလိုပါကျွန်တော်ကင်ဆာရောဂါဆိုတာကိုလူတိုင်းကြားဘူးပါတယ်ကျွန်တော်တို့ဘေးပတ်ဝန်းကျင်မှာလည်းကျွန်တော်တွေ့နေရတယ်ပေါ့နော်ကိုနဲ့ယဉ်ကျေးတဲ့သူတွေကိုချစ်ခင်ရတဲ့သူတွေမှာလည်းတချို့မှာကံကောင်းကြောင်းမလားပဲနဲ့ကင်ဆာရောဂါဖြစ်နေတာတွေကျွန်တော်ကြုံတွေ့နေရတယ်ဟုတ်ပြီလူတွေကကင်ဆာရောဂါဆိုတာကိုကြားဘူးတယ်ဒါပေမဲ့ဒီရောဂါကဘယ်လိုမျိုးလဲဆိုတာကိုကျွန်တော်ခြေခြေမြင့်မြင့်မသိရကင်ဆာဆိုတာဘာလဲဘာကြောင့်ဖြစ်တာလဲဘာဖြစ်လို့ကြောက်ဖို့ကောင်းတာလဲလူတွေအနေနဲ့ကင်ဆာကိုဘယ်လိုမျိုးပေါ့နော်စဉ်းစားတင်လဲဆိုတာပေါ့နော်ဘာကြောင့်စိုးရင်တင်လဲဆိုတာဒီအကြောင်းနဲ့ပတ်သက်လို့ကျွန်တော်တို့နည်းနည်းရှင်းပြပေးအဲ့တော့ပထမဆုံးမေးခွန်းကတော့ကင်ဆာဆိုတာဘာလဲပေါ့နောက်တစ်ခါကျဘာဖြစ်လို့ကြောက်ဖို့ကောင်းတာလဲဘယ်လိုမျိုးဝိသေသလက္ခဏာတွေကိုကျွန်တော်တို့ကင်ဆာလို့ခေါ်တာလဲဒါလေးကိုတစ်ချက်လောက်ရှင်းပြပေးပါဆရာ
So first and foremost what is cancer So cancer is when cells keep growing uncontrollably it starts to get into a big growth and it starts to spread, invades other parts of the body, and finally takes the life of the patient. So that essentially is cancer. Why are people scared of cancer? Because all these years, cancer has a bad reputation. Cancer is difficult to treat, sometimes difficult to diagnose, and difficult to control. And when that happens, the cancer will then ultimately win the battle against the patient, and the patient will then succumb and die from the cancer. And additionally, I would say that most patients are also scared of the treatment, the old treatments that we used to give. We give people chemotherapy, it causes people to drop their hair, lose their hair, yes. They have nausea, they vomit, they have fevers. And these are some of the unpleasant side effects of cancer treatment. So when you put all together, the disease, the treatment, seeing other patients succumb to cancer, when you put all them together, it definitely creates a lot of fear in our patients, in our population.
Okay, I see. Thank you very much for your answer, Dr. Richard. So now tell me go look how be general cancer ဆိုတာဘာလဲဆိုတာသိရပြီဘယ်လိုမျိုးအကြောင်းရင်းကြောင့်ဖြစ်နိုင်လဲဆိုတာကိုကျွန်တော်သိရတယ်နောက်ထပ်ကျွန်တော်သိချင်တဲ့မေးခွန်းကဘာဖြစ်လို့ပေါ့အခုနောက်ပိုင်းမှာဆိုရင်ကျွန်တော်တို့ကင်ဆာရောဂါတွေကိုအများကြီးတွေ့လာတယ်အရင်တော့ဆိုရင်တော့ကျွန်တော်တို့ကကင်ဆာဆိုတာလူကြီးတွေမှာပဲအသက်ကြီးရွယ်တွေမှာတက်ကြီးတဲ့သူတွေမှာပဲဖြစ်တယ်ဆိုတာကိုကျွန်တော်သိရပြီးတော့အခုနောက်ပိုင်းမှာကျွန်တော်ငငယ်ရွယ်ပေါ့နော်တချို့လူငယ်တွေမှာတော့မှဘလို့မှကျွန်တော်မထင်ထားတဲ့အရွယ်တွေတော့မှကင်ဆာရောဂါတွေပိုပြီးဖြစ်လာတယ်ဟုတ်ပြီကျွန်တော်သိချင်တဲ့ဟာကဘာကြောင့်ဒီလိုမျိုးကင်ဆာတွေပိုပြီးအဖြစ်များလာတာလဲဘလို့အကြောင်းရင်းတွေကကျွန်တော်တို့ကင်ဆာရောဂါတွေပိုပြီးဖြစ်လာစေတာလဲကျွန်တော်တို့လူနေမှုပုံစံတွေကျွန်တော်တို့နေထိုင်စားသတ်မှုပုံစံတွေကကင်ဆာဖြစ်စေဖို့အကြောင်းရင်းတွေများဖြစ်နေလားဒါလေးကိုတစ်ချက်ရှင်းပြပေးပါဆရာ
So the question is what causes cancer? And so in my mind, cancer is a genetic disease. The cells, all our cells are good. They are programmed to grow. They are programmed to stop growing. There's a very pre-programmed way of doing things. However, in a cancer cell, there's something wrong with the genetic information. The cancer cells grow non-stop. They have gained the ability to invade surrounding organs, and they have also gained the ability to spread, and thereby taking over the life of the patient. So it's a genetic disease. The next question is, how did this genetic disease occur? We can subdivide them into three broad classifications. I think the first classification is a bloodline inheritance, something that's passed from generation to generation, parents to children, something in the genes that's passed down that makes the patient susceptible, prone to getting cancers. However, these numbers of patients, thankfully, are the minority. They account for less than 5 to 10% of all cancers in general. So while this is a possibility, it is the minority. Now, the second big group of cancer are genetic abnormalities that are derived after birth. So these are what we call somatic mutation. The mutation occurs by chance, and when it occurs in the cells, it causes the cancer to keep growing. It drives the cancer forward. And so understanding this second process is important because if you know what drives the cancer forwards, you can then implement medicine, treatment to stop the process. And that's what we call targeted therapy.
Okay.
In the third group of cancer-causing factors, we look at lifestyle changes. There are many things that in the lifestyle that are not so good. For example, smoking, excessive alcohol, certain toxins that we eat, like we take like betel nut. So these all can cause different types of cancer. Lifestyle also can result in different viruses in our bodies. Human papillomavirus is one of them. Another one that is known to be associated with cancer is the HIV, human immunodeficiency virus. These are some of the agents that can cause cancer.
Okay.
Just to expand it a little bit, the lifestyle is important. We think of direct lifestyle like smoking. Smoking damages the lungs, and the lungs will then develop the cancer. Excessive drinking can damage the liver, causes hardening of the liver, and therefore lead to liver cancer. But there are many other lifestyle factors. For example, obesity, lack of exercise. Those are harder to quantify, but they also contribute to cancer formation.
Thank you, Dr. Richard. So, အဲ့ဒါဆိုရင်ကျွန်တော်ထပ်ပြီးတော့ဒီဟာလေးနဲ့ပတ်သက်လို့ဆက်ပြီးတော့ follow up မေးခွန်းလေးမေးချင်ပါတယ်ဆရာ။ဘာလဲဆိုတော့ဆရာပြောတဲ့အတိုင်းမှာဆိုကျွန်တော်အတူတူပြောရမယ်ဆိုရင်ကင်ဆာကဖြစ်နိုင်တဲ့အကြောင်းရင်းက3ခုကြောင့်ဖြစ်နိုင်တယ်ပေါ့နော်။ပထမတစ်ခုကတော့မျိုးရိုးသူတို့က genetics ကြောင့်ပေါ့နော်။အဖေမေမှာဖြစ်တယ်ဆိုရင်ကိုသားသမီးမှာဖြစ်တယ်ဒါကမျိုးကြောင့်ဖြစ်တဲ့ကင်ဆာဒုတိယတစ်မျိုးကတော့ကြာတော့မျိုးရိုးတော့မရှိဘူးဒါပေမဲ့သူ့ဘာသာလိုထဖြစ်တဲ့ mutation ကြောင့်ဖြစ်တဲ့ကင်ဆာနဲ့တတိယတစ်မျိုးကတော့ဒီအစားအသောက်အနေထိုင်တွေကြောင့်ဖြစ်တဲ့ကင်ဆာဆိုပြီးတော့ကျွန်တော်3မျိုး3စာခွဲနိုင်တယ်လို့ကျွန်တော်ဆရာပြောတဲ့အရာဆိုသိရပါတယ်။ဆိုတော့ကျွန်တော်သိချင်တာကဘယ်ဒီ3မျိုးထဲမှာဘယ်အမျိုးအစားကအဖြစ်အများဆုံးလဲဆရာဘယ်လိုကင်ဆာမျိုးကိုကျွန်တော်တို့တွေ့ရတာအများဆုံးလဲဒါလေးတစ်ချက်ဖြေပေးပါအောင်ဆရာ
I think the most common types will be the second and third genetic mutation happening in cancer cells causing the cancers to go haywire. Environment and lifestyle factors are also important, increasingly important and increasingly recognized. So therefore the third part will be, I would say, controllable. If you can quit smoking, cut down alcohol, healthy lifestyle, fruits and vegetables, less obesity, you can actually cut down on the risk of cancer formation. There was a nice study reported some years ago that says that up to 40% of cancers can be due to controllable lifestyle factors.
I see.
So you can't reduce your risk to zero, but you can certainly reduce your risk by a lot.
Great. Thank you very much, Dr. Richard. Thank you so much. နောက်ထပ်မေးခွန်းတစ်ခုကတော့ဒီလိုပါဆရာအခုဆိုရင်ကျွန်တော်တို့ကလူတွေကကင်ဆာဖြစ်ပြီဆိုတာနဲ့ပေါ့တည်တော့မယ်လို့ကျွန်တော်ယူဆကြတယ်ကင်ဆာယောဂနဲ့ကျွန်တော်တို့ကပေါ့စမ်းသပ်တွေးရှိလိုက်တယ်ကင်ဆာယောဂတွေးရှိရဲဆိုရင်ကျွန်တော်တို့ကသိမင်းကြတဲ့လူတယောက်လိုမျိုးဖြစ်သွားတယ်ပေါ့နော်အဲ့တော့ဟုတ်ပြီကင်ဆာယောဂကတကယ်ကိုအဲ့လောက်ထိစိုးရင်ကြောက်ရွံ့စရာကောင်းလားကျွန်တော်တို့ကင်ဆာယောဂဖြစ်ပြီဆိုတာနဲ့တကယ်ကိုတည်ဖို့စောင့်နေရတဲ့သူတယောက်လိုမျိုးဖြစ်နေပြီလားဆရာအဲ့ဒါလေးကိုဆရာရဲ့အမြင်လေးကိုကျွန်တော်သိချင်ပါတယ်ဆရာ
No, I think that perception should change with time. I would say that in a cancer group of patients, I divide them into 1/3, 1/3, 1/3. There'll be the first 1/3 whose disease has spread, stage 4 disease when they first diagnosed. These are patients who you may not be able to cure. You may be able to give treatment to control the disease for a long time. Increasingly, we have new treatment, targeted therapy, immunotherapy, which we'll elaborate in a short while, that can extend the life of the patient. Especially with immunotherapy coming on board, even stage 4 patients, at least 5 to 10% of cancer patients can live long term with treatment. On the other spectrum, the initial 1/3 are people who found the cancer very early. For example, they go for cancer screening, breast cancer screening, pap smear for cervix, colorectal screening. Once you find them early, those patients are potentially very, very curable. With the right treatment, with the right surgery, patients can be cured. They live a long and fruitful life. Now we have the last remaining 1/3, which is in between. The disease is not that early, it hasn't spread, and those will deserve a hard fight. A hard fight meaning you must give the right treatment to make sure you eradicate the disease, you control the disease, and give the patient the best chance of surviving the cancer. So I would say that in this day and age, cancer, while it still has its bad reputation of being a very tough disease to handle, but I think that the treatment options that the patients have these days is a lot better. The effectiveness of treatment is a lot better. Even stage 4 patients live for a long time with good many years, some even more than 5 years. And the side effects of the treatment has shrunken, has dwindled significantly. A lot of our new treatment these days do not cause hair loss, do not cause nausea, vomiting. Immune system is okay, no fever. So a lot of positives to take home.
I see. Great. Thank you very much, Dr. Richard. So this will be the follow-up question. As I know, now that the cool out the ali follow up tomorrow. You know what tin hake can start to be so ne long theme about can saga what long be time packing kutalumia who are tain packing kutalumia. Siamoni Martin Legend of Pioraga, one of the Yamato Pioraga can sa with an arch in a 5 years survival. Money Matashin 9 point from an ablashi less Mamuti. Can start to be so in Loma who Piakan Kutalumia Utame or Piamican in my pace with the general Usaka. Fair Joya no, and you start money or not general ma can Saga 40 Loma be time packing out or Kutalu for the forward, no?
Yes. So again, I want to dispel the myth that cancer is incurable. If you find the cancer early, if you find the cancer early at the early stage, and you give the patient good treatment with surgery, with radiation, with chemo, the cancer can be cured. So we shouldn't be fatalistic and to think that the cancer cannot be cured. However, if you let the cancer run wild, you don't give treatment, you find the cancer late when it spreads all over the body, then the cancer cannot be cured. So there's a lot of incentive for patients to do screening, pick up the cancer when it's at an early stage, when it's small, treat it accordingly, treat it appropriately, so that the patients can be cured and they can live a normal life after that. You see.
I see. Great. Thank you so much, Dr. Richard. So this will be the follow-up. The sit like my theatre, sit like my theatre, sit you Kulu Miami, the Kuna Jota New Wego, okay, Sergeant Kulu Miari yoga, pero maybe I'll the yoga, you started Prejamu. Sit like Biro, cool like or sit like Biro Ma, Tila and Buviro 16 year old, when a quarter Buviro, say to Kaya Wadi, my 8 Prejam, the Selim Sedo, Maku, Kupian and Makuro, so we are to know what, and you suck it, you see. Sia Joya to me, Kin Saga, so Tian no Biro, so sit, so Tian no Biro, so Kume to me. No one Piama Pito in it, account time to go you.
Absolutely right. And therefore, I cannot stress enough that we need to detect the cancer proactively, to do the appropriate screenings according to the guidelines, and that gives us your best chance. Rather than you lie backwards and say that it cannot be cured and don't do anything about it, then of course you're going to fulfill that promise. You see.
I see. Great. Thank you very much, Dr. Richard. နောက်ထပ်သိချင်တဲ့ဟာတစ်ခုကတော့ကျွန်တော်တို့အခုဒီနှစ်တွေတွဲမှာဆိုရင်လည်းစိတ်ပညာကအမခန်တိုးတက်မှုတွေရှိလာတယ်ပေါ့နော်အဲ့တော့ကျွန်တော်သိချင်တာကအခုဆိုရင်ဆရာတို့မှာရှိတဲ့အခုလက်ရှိပေါ့နော်အရန်ကို advance ဖြစ်နေတဲ့အရှိကိုခင်မီနေတဲ့ကင်ဆာကုသမှုတွေနဲ့အရင်တော့ရှိခဲ့တဲ့ကင်ဆာကုသမှုတွေကဘယ်လိုမျိုးကွဲပြားခြားနားမှုတွေရှိလဲနောက်တစ်ခုအဲ့လိုကွဲပြားခြားနားလာတဲ့ကုသမှုတွေပို့ပြီးတော့ရှေ့ကိုခင်မီလာတဲ့ကုသမှုတွေကကင်ဆာယောဂဝေဒနာရှင်တွေအတွက်ဘယ်လိုအကျိုးကျေးဇူးတွေပေါ့နော်အရင်နဲ့ကွဲပြားတဲ့ဘယ်လိုအကျိုးကျေးဇူးတွေဖြစ်ပေါ်စေပါကလဲအဲ့အကြောင်းရင်းလေးကိုကျွန်တော်နည်းနည်းလေးရှင်းပြပေးစီလိုပါတယ်
I think in the last 30 years the cancer treatment field has completely changed and many areas of improvement. You can start off, we're talking about screening of cancer. What are the strategies available for picking up the cancer early? You can talk about the strategies for preventing the cancer in the first place. Then, if a person will be unlucky to have cancer, how to pick them up early, the appropriate scans, and then the appropriate treatment. At the tail end of life, the patients with advanced stage 4 disease, how do you manage the symptoms? How do you make people live longer with the appropriate medicine? Now let's start from cancer prevention. Cancer prevention is very important. The best thing is don't get cancer. The best is to prevent yourself from getting a cancer. And you can start off with simple things like vaccination. Hepatitis B vaccination is the best example. Hepatitis B is very common in Asia. Hepatitis B leads to liver cancer, and liver cancer is hard to treat. But we can prevent all this simply by having a hepatitis B vaccination. We can reduce our alcohol intake. These are clear risk factors for liver cancer. In women with cervix cancer, we can always prevent that with vaccination for the human papilloma virus. I noticed that the cervix cancer rates are high in Myanmar, and that can be easily prevented by human papilloma virus vaccination. Now, for the second group of patients who unfortunately develop the cancer, then the key is to find them early. And the best example for women, again, is breast mammogram. You do a breast X-ray, as you call it, and you can find the cancers at early stage, even with a stage 1 or stage 0. you do a simple operation, and you can get rid of the disease. If you leave it alone, it will become stage 2, stage 3, and stage 4. It's much harder to treat later. At early stage, patients can be cured. Again, coming back to the Myanmar situation for cervix cancer, a simple way to find cervix cancer early is a pap smear. So pap smears are very commonly done. They are very low cost. It can be done when a patient is delivering a baby or when the patient turns sexually active. Finding the cancer early, you can give appropriate treatment. You can get rid of your incidence rates for cervix cancer. You can really drop it significantly. Then the next advancement we see is all the multidisciplinary. The radiology, the pathology are very effective. We have good scans to pick up the cancer, like MRI, PET scans. Our pathology, who looks under the microscope, have a huge array of testing, not just the microscope alone. They've got chemical stains. You can use molecular tests to find the right cancer. You find the cancer, then you find what the cancer is the weakness of the cancer is, where the molecular abnormality is, so that oncologists like myself can then use the right medicine for the right patient. So this is a major advancement. And within medical oncology, I would say that things have moved very, very rapidly in the last 10 years. We started with targeted therapy to attack the cancer at various points of its weaknesses. In the last 10 years, we started using immunotherapy, which is effective in more than 12, 15 types of different cancers. And the immunotherapy is good because it doesn't kill the cancer directly. It doesn't cause side effects. What it does is raises the immune system of the patient and allow the patient's immune system to go after the cancer. So it's effective in a whole range of cancers, not just specific. And the side effects are very different from the rest of the chemo. It doesn't cause nausea, vomiting. Its side effect profile is more well tolerated, completely different from what we are used to. And so all these techniques, all these machines, including radiation, surgical techniques, all contribute to the advancement in cancer outcomes.
I see. So this is a follow-up question, Dr. Richard. So Dr. Richard, now that you know the naga, the kuat diluba, general the churi bono, senzara, kinsa yoga japu goni, money, I kinsa yoga netu, not a japu goni yaku balesra, kinsa kutare kutomi, general the Yoshin Remale, Yen Dunia, kinsa yoga, kutali sorane, general, Sabine Jukome, Karum, you, Kiwame, not what you can call a champagne name, the side effect, see a beta surgery, the radiation detecting I beta surgery, general Yankan with your general near Usagera. And a jam lube, inside yoga pinning on Aram Kuro, so your choice in our Mushibare. So, see, I pure yasin, not Kusoin, Kimmy, Nibinaria, Kinsakuta, Kutonia, Yao Kiminare, the Jamlu, Kunaburi with Nalakanari, who the Kutamwe, now set to beta surgery, Kanvaris, Jane Pimamiaro, Jane Mapinino, Gulu, Joluyaro, no?
No, I think, Dr. Rin, the best answer is that to treat cancer, we need all the tools we have. We need all the weapons we have. And the weapons may include immunotherapy, targeted therapy, surgery, radiation, and even the old chemotherapy.
I see.
I always tell my patients the side effects of a treatment that you render is always, or more like is predominantly due to the dose of the drug that you use, especially chemotherapy. And in chemotherapy, there's always a fixed dosing. If you reduce the dose or you control the dose, the side effect profile is a lot more manageable. But if you persist, if a patient is weak and you persist in using the higher doses, then of course the patients will develop a lot of side effects. Even the chemotherapy family, the new ones that are in the market are generally well tolerated. So what we always see, or what we always see in the movies, it's probably a thing of the past. We are a lot better in understanding how to use these medicines, how to tailor it, and how to use it in each patient. And no two patients are the same. For example, if you have a patient elderly in the 70s, a bit weak, and you were to give the same dose, they're going to develop a lot of side effects. Compared to a young person who is in the 30s and 40s, and you give again the same dose, the side effect profile may be a lot better. And therefore, it takes a bit of experience as well to manage the chemotherapy and manage chemotherapy side effects. And you must be ready to adjust your dose so that you can make sure that patient takes it well, tolerates the treatment.
Thank you so much, Dr. Richard. ကျွန်တော်နောက်ထပ်သိချင်တာကဟုတ်ပြီဒီကင်ဆာကုသမှုတွေအပြင်ကိုပေါ့နော်တခြားဆရာအနေနဲ့ဒီလူနာတွေဒါမှမဟုတ်လည်းအခုကြည့်ရှုနေတဲ့သူတွေကိုပေးချင်တဲ့နည်းလမ်းတွေအကြံဉာဏ်တွေ suggestion တွေ advice တွေများရှိမလားအဲ့ဒါလေးရှိရင်ကျွန်တော်ပြောပြပေးပါဦး
So I think that we have spent a lot of time talking about advanced techniques, advanced treatment technology, chemo, and all that. But let's also not forget about the simple things, how to prevent the cancer, prevention, how to detect them early detection. So prevention, important to get all the vaccination, healthy lifestyle, stop smoking, moderate alcohol intake, exercise, keep your weight down. These are very important and they can really eliminate a significant percentage of cancers. And as well as early detection, simple things like mammogram, pap smear for the ladies, and for both gender, colonoscopy, age 50 to check whether there's any colonic polyps or colonic tumors. So these are very effective to find the cancers early. And when found early, they can be easily treated. So we shouldn't forget about those things.
Okay, thank you so much. Okay, အခုဆိုရင်ကျွန်တော်တို့ကင်ဆာကြောင့်နဲ့ပတ်သက်ပြီးတော့ပြောလာတာလေတော်တော်များနေပြီဆိုတော့နောက်ဆုံးမေးခွန်းလေးတစ်ခုကိုကျွန်တော်လူတိုင်းသိချင်နေမယ်ထင်တဲ့နောက်ဆုံးမေးခွန်းတစ်ခုကိုကျွန်တော်မေးလိုက်အောင်အဲ့ဒါကဘာလဲဆိုတော့ကျွန်တော်တို့ကင်ဆာယောဂဖြစ်နေပြီဆိုတာကိုကျွန်တော်ဘယ်လိုမျိုးနီးလန်းနဲ့သိနိုင်လဲဘယ်လိုမျိုးနီးလန်းနဲ့ကိုဟိုပေါ့ယူဆလို့ရမလဲဟုတ်ပြီဖြစ်နေတယ်ဆိုတာကိုသိပြီဆိုရင်တော့ကျွန်တော်တို့ဘာဆက်လုပ်ကြရမလဲဖြစ်နေတယ်လို့ထင်တယ်ဆိုရင်ကျွန်တော်ဘာဆက်လုပ်ကြရမလဲဒါလေးကိုအကြံဉာဏ်အနေနဲ့ကျွန်တော်လက်ရှိကြည့်နေတဲ့သူတွေကိုဆရာအနေနဲ့အကြံဉာဏ်ပေးပေးပါအောင်ခင်ဗျာ
Okay. All right. So I would always tell my patients that the best time to treat the cancer is the very first time. So you treat it well, treat it properly so that it never comes back.
Okay.
And that's the key. So some of the symptoms, and the symptoms can be very varied in cancer. They can present with a lump that's painless, a lump that's growing. There could be blood discharge, either from passing motion, urine, or breathlessness. So the symptoms are very varied depending on where the tumor is. But whenever a new symptom appears or a new growth appears, do get it checked up. But once cancer is suspected, then the first thing we should do is before we do any surgery or any procedure or whatever, let's get a scan first to see what is the situation. It's like taking a photograph, but using obviously a radiological technique here. Take a scan to see what is the situation, what does it look like. Invariably, we need to do a biopsy. A biopsy means you take a small bit of tissue out of the tumor, analyze it under the microscope, know exactly what you're dealing with. I will always do staging tests to see whether the cancer has spread before I start treatment.
Okay.
Once we have all that information, the doctors should sit together and do a planning, especially the medical, surgical, radiation, at least have a discussion to develop a plan. And this is what we always do. Develop a plan right at the start. If the disease is very localized, then by all means we should take it out. If the disease needs chemo first or radiation first, by all means we administer those treatment first, followed by surgery. And the plan should be a good plan that's widely advocated in the international guidelines, supported by clinical research, and carry out the plan accordingly. And that will usually guarantee the best outcome for our patients.
မိကုန်းနေအကုန်လုံးကိုဖိတ်ရှစ်လက်ရှိဖြည့်ပြီးတဲ့အတွက်ကျေးဇူးများတင်ပါတယ်ခင်ဗျာဒီ Parkway Cancer Center ကကင်ဆာရောဂါအထူးကုဆရာဝန် Dr. Richard Quat ကိုကျွန်တော်တို့ဒီ Mount Elizabeth Facebook page ကနေပြီးကျေးဇူးများတင်ပါတယ်ခင်ဗျာ
Thank you so much, Dr. Rin. Really pleasure speaking with you.
အခုဆိုရင်ကြည်နေတဲ့သူတွေအနေနဲ့လည်းကင်ဆာရောဂါဆိုတော့ဘာလဲဘာကြောင့်ဖြစ်ရတာလဲဘယ်လိုမျိုးတွေကျွန်တော်သတိထားတင်လဲကင်ဆာရောဂါဖြစ်နေပြီဆိုရင်လည်းဒါကသိမိတ်မဟုတ်ဘူးဒါကသိဖို့စောင့်နေရတဲ့ဟာမဟုတ်ပြဿနာမဟုတ်တော့ဘူးကျွန်တော်ကုသလို့ရတယ်ကုသလို့ရတဲ့ခင်မီနီလန်တွေအများကြီးရှိနေပြီဆိုတာကိုကျွန်တော်သိသွားမယ်ကင်ဆာရောဂါကိုဘယ်လိုမျိုးစစ်ဆေးလို့ရမလဲဘယ်လိုမျိုးစောစောစီးသိအောင်လုပ်ရမလဲဆိုတာတွေကိုတော်တော်များများသိသွားလိမ့်မယ်လို့ယူဆပါတယ်နောက်လဲကျွန်တော်တို့ဒီလိုမျိုးပေါ့နော်အလားတန်တူတဲ့ဟိုကျမကြီးသိပညာပေးတဲ့ဗီဒီယိုတွေကိုအများကြီးထပ်ပြီးတော့ဟိုတက်သက်ပေးဦးမှာဖြစ်တဲ့အတွက်ကြောင့်စောင့်ကြည့်ကြည့်ရှုနိုင်ပါတယ်အဲ့တော့ကြည့်ပေးတဲ့အတွက်ကျေးဇူးအများကြီးတင်ပါတယ်ခင်ဗျာ